Good morning. It's good to see everybody again. This will be a quick overview of what the Leukodystrophy Care Network is. It's been presented before, but um, we have actually a couple of new centers, I think, this year. And so I put together some pictures of people so you can associate all the various experts. But just briefly, what is the idea here? And this is something that I think came from Jackie Wagner. And based on the experience that they had with Hunter, is that to establish a network that will really revolutionize the health and quality of life for individuals affected with leukodystrophies. And as you know, this started many years ago and is really led by you all, by the patient advocates, by where several of you are sitting on the steering committee. And this went back to sort of the statement that we made about just because there isn't cure, it doesn't mean that we can't help. And so it really, there's a lot that needs to be done in any leukodystrophy patient, and it changes based on the stage of the disease they're in, the stage of development and age that they're in. We cannot just ignore them. And here's some examples of the things that we can do, and we can do well. Like as Dr. Kurtzberg mentioned, we can manage pain really well. So it would be a shame to miss it just because a person can't express themselves. We can manage seizures really well. We can manage irritability and sleep pretty well. For those things, we have medications available. Nutrition is extremely important. You know, when you miss calories and you don't grow, your body is not healthy. And so obviously that will affect disease course. And really, when we look at survival now, we see that survival of individuals is much longer than it was before. And that has to do with just trying to improve the care on a day-to-day basis and so provide a better quality of life. You know, one thing that is not listed here that is becoming more and more of an issue, and it's more of an issue for multiple reasons. One of it is, I think, people recognizing that mental health is important, and you know, there's a stigma with mental health that nobody wants to talk about. But at the same time, also, we've seen really since the pandemic started that there has been a threefold increase in general population of mental health problems. And so really, I think a major area that is emerging now is trying to manage behavior of affected individuals, but also family members, and especially siblings, parents that really are involved day to day. And that's difficult, and there are very limited resources available. So you know, the aspiration of these centers is that we get to a point where we can address all these issues in addition to doing the best available therapies. Like hearing the gene therapies emerging now. We have now 2 approved gene therapies, one for ALD, one for MLD, but still very few treatment sites. And the hope is that we will soon get to a stage where, you know, all the LCNs are able to really address these issues. Now, part of it doesn't have to do with the centers. It's more the complexity of manufacturing the product that the patient needs to get, the timing, how you have to do it, and so on. There's lots and lots of logistics. You know, just talking about like getting to a transplant within 30 days. It's like you know, I don't know. It's like building another Titanic. It's just a really difficult task to do that because there's so many little things that need to happen on time and in place. So that's one of the goals of the LCNs. The other has been that we have really had several papers and publications coming out in terms of guidelines on standard of care. Obviously, that's a moving field. The more technology available, the more therapies available, the more we learn about these diseases, the more these things need to be changed. So, you know, we published, for example, a few years ago, a paper on management of seizures. There's a bunch of new drugs now. So this is a continuous effort that our group are involved with, and so on. And again, the overall goal is to make sure that we have standard guidelines so that even beyond these centers of excellence, that the general sort of community pediatricians and neurologists and so on can help. With that said, I just want to run briefly down the list of the centers. So it's exciting because we are now 14 centers, and this is in alphabetic order. So there is no preference given to anyone. And each center has typically now a center director, an associate director, a center coordinator, and several other staff members. And some centers have even co-directors. To be honest, I just didn't have the time to put all those pictures in there, and I'm not even sure if I have a coverage of all of them. And so Anna, this is really help that Anna provided to put this together. We put together just a center directors and coordinators, so you know, but that doesn't mean that we want to be dismissive of others. So the Lurie Children's in Chicago is Dr. Ruben and Rachel, who are basically running the show there. Then in Atlanta, we have Dr. Keller, who's very involved from the beginning, but both have been very involved, Dr. Ruben and Keller. One of our newer centers is in San Antonio, Dr. Abula. And Angela is the center coordinator. So I'm excited about that because, you know, Texas is a big state and there's a real need for having dedicated centers. In New York, we have another new center, although the director is I almost say old guy, he's my age, but we've been both involved in the care of leukodystrophies all our adult lives, let's say it this way. And so Dr. Magawa is a pediatric geneticist and metabolic geneticist who's very focused on lysosomal storage disorder specifically, and Caitlin. So you have them in New York. There's another center in New York, but since this is alphabetic, I'll come back to them. Then, of course, you know, we don't need to, nobody does not know Dr. Kurtzberg and Duke has been very involved, and Tara has been the partner in crime for many years, I think, with Joanne. Then Dr. Thompson Stone and Nicole in Rochester. You know, Dr. Stone was very active yesterday and the day before running the scientific symposium. So thanks to him for doing that. Another relatively new center is the Oyster Children's Hospital with Dr. Hughes and Mary Beth. I don't think they joined a year ago, 6 months ago. How long ago? Anyway, so then we got Kennedy Krieger, that's us, and Kim, who has been my partner in crime for many years. We have Mass General Hospital with Dr. Eichler and Katie, who's the associate program director there. And then Mount Sinai, we recently joined Dr. Reynes and Alexandra. And I think again, Margie Ream, everybody knows her here. Dr. Ream is Nationwide Children's, Janice, and in Utah, we have Dr. Bunkowski, Courtney. At Stanford, we have Keith Van Haren. I don't know what happened to his coordinator, sorry. But Dr. Van Haren is all rounded, so he can do it all. But no, I know he does have other team members there. It's just my spelling. And then UC Davis, who joined a few years ago, Dr. Bill Benko and Cassandra, who I think joined a couple of years ago, his team. So these are the centers. So it's pretty spread across the country. There are also some affiliate centers, of course, other places that do amazing work. I assume most of the patients here are hooked up with one of these centers. If not, I would strongly advise that happens, regardless of what stage of the disease the patient is in. And I'm actually going to stop. So this is really just a brief overview. Thank you.